I am here to show how to perform tracheostomy tube care. We perform tracheostomy tube care to maintain airway patency and decrease infection risk by removing secretions that accumulate within the inner cannula. First, make sure you have all the equipment needed at the bedside. This includes personal protective equipment, or PPE, sterile normal saline, sterile cotton swabs, sterile 4x4 gauze pads, a tracheostomy tube holder, a sterile pre-cut tracheostomy dressing, a sterile disposable inner cannula of the same size, and suction supplies. Next, explain the purpose and the importance of the procedure to the patient and the family. This will help encourage cooperation and reduce anxiety. It is important to evaluate the patient's cardiopulmonary status. This assessment provides valuable information about the need for and tolerance of tracheostomy tube care. You will need to assess for decreased arterial oxygen saturation, cardiac dysrhythmias, bronchospasm, respiratory distress, cyanosis, increased blood pressure or intracranial pressure, and anxiety, agitation, or changes in level of consciousness. Before starting the actual procedure, verify the correct patient with two identifiers. So I'm just going to verify your identity really quick. Perfect. Also, check to ensure the patient understands your pre-procedural teaching. Okay, Charlene, I'm here. I'm going to do your tracheostomy care, which requires a little bit of suctioning. Reinforce this information as needed. Perform your hand hygiene. Then, apply your PPE. In this case, gloves and a face shield. It is important for you to wear a protective face shield. Next, hyperoxygenate and suction the trachea and pharynx as needed. Perform suctioning prior to the dressing change. Open the suction kit and don sterile gloves. This is how you perform suctioning using a sterile technique. Remember, only make 3 passes with the suction catheter for a maximum of 10 seconds with each pass. You can apply intermittent suction when removing the catheter, not upon insertion. Hyperoxygenating the patient reduces risk of hypoxemia and arrhythmias. Suctioning the patient diminishes the patient's need to cough during the procedure. Now, we can remove the soiled tracheostomy dressing. After removing the dressing, remove your gloves and perform hand hygiene again. Next, open the pre-package of the inner cannula package. Apply clean gloves. Next, remove the oxygen source from the tracheostomy and place it over or near the outer cannula or on the patient's neck. After disconnecting the oxygen source, remove the soiled inner cannula. Now, insert the pre-packaged inner cannula and lock it into place. Remember to keep the pre-packaged inner cannula sterile throughout the process. Then, reapply the oxygen source to reestablish oxygen supply. After changing the inner cannula and reestablishing oxygen, you can now remove debris and secretions from the stoma area. To do this, moisten some cotton swabs and 4x4 gauze pads with sterile normal saline. Next, use the swabs and pads to wipe clean the stoma site, outer cannula, and neck plate surface area. Remember to pat dry the skin area surrounding the stoma site. This decreases the likelihood of microorganism growth and skin breakdown. Now we are ready to change the tracheostomy tube holder or neck ties. Have an assistant hold the neck plate securely so you can now remove the old tracheostomy tube holder. It is important for the assistant to maintain neck plate stability while you change the tube holder. Attach a new tracheostomy tube holder. To do this, connect one side of the neck plate to new tracheostomy tube holder. Then connect to other side of neck plate and tighten the tube holder. Allow room for just one finger under the holder to ensure it is secure. Next, apply your pre-cut tracheostomy dressing under the neck plate. Never cut a 4x4 gauze pad because the cut edges fray and provide a potential source for infection. Now, provide appropriate oral care and suction again, if needed. Finally, discard all of your used supplies and remove your PPE. Now you know the proper way to care for a tracheostomy tube, change the inner cannula, and change the tube holders. Thank you for watching.